What if the real reason you are concerned about your girth has nothing to do with genetics, nothing to do with hormones, and everything to do with something that is happening right now in your pelvic region that you have probably never even thought about? What if I told you that thousands of men are walking around with penile tissue that is restricted, compressed, and prevented from reaching its full potential, and that a simple 2-minute stretching technique could change everything? I am here to share something with you that most men never learn, and it has the potential to make a dramatic difference. Stay with me, because what you are about to discover might completely change how you think about this topic. Let me start by addressing the elephant in the room. Girth is something many men think about, but few feel comfortable discussing openly. There is so much misinformation out there, so many scams and false promises, that most men have just resigned themselves to accepting whatever they have. But here is what I need you to understand. In many cases, the girth you currently have is not your actual maximum girth. Your tissue is capable of more, but it is being held back by something specific, something fixable. The number one reason men do not achieve their full natural girth potential has to do with something called pelvic floor tension and fascial restriction. Now, I know those terms might sound technical, but I am going to break this down in a way that makes complete sense. Your penis does not exist in isolation. It is connected to a complex network of muscles, connective tissue, and fascia that extends deep into your pelvic region. In fact, roughly half of the total penile structure is actually inside your body, anchored to your pelvic bones and surrounded by layers of tissue and muscle. Think about it this way: the visible portion of the penis is just part of the whole structure. There are internal portions, often called the penile roots or crura, that extend back into the pelvis. These internal structures are surrounded by something called the pelvic floor muscles. These muscles form a hammock-like support system at the base of your pelvis. They control urinary function, bowel function, and play a crucial role in sexual function. When these muscles become chronically tight or tense, they can actually compress and restrict the penile tissue, preventing it from expanding fully during arousal. Here is where it gets really interesting. Most men develop chronic tension in their pelvic floor muscles without even realizing it. This tension can develop from sitting for long periods, from stress, from improper breathing patterns, from holding tension in the lower body, or from past injuries or trauma to the pelvic region. Over time, this chronic tension becomes the new normal. The muscles stay contracted, the fascia becomes tight and restricted, and the penile tissue cannot expand to its full capacity. The fascia is particularly important to understand. Fascia is a type of connective tissue that wraps around and connects everything in your body. It is like a three-dimensional web that holds your muscles, organs, and structures in place. In the pelvic region, there are multiple layers of fascia that surround the penile structures. When fascia becomes tight or restricted, it can create a compression effect that limits tissue expansion. Imagine trying to inflate a balloon that is wrapped tightly with rubber bands. The balloon wants to expand, but it is being held back by external restrictions. This is similar to what happens with penile tissue when the surrounding fascia is tight. Blood flow also plays a critical role in girth. During arousal, blood flows into the erectile chambers of the penis, causing expansion and erection. But if the pelvic floor muscles are chronically tight, they can compress the blood vessels that supply the penis, reducing the total blood volume that can enter the tissue. Less blood volume means less expansion, which means less girth. This is not about having poor circulation overall. This is about local compression in the pelvic region, specifically restricting blood flow to the penile tissue. There is another factor that many men do not consider. The ligaments that support and anchor the penis can also become tight and restricted. The suspensory ligament in particular connects the penis to the pubic bone. When this ligament is tight, it can pull the internal portions of the penis closer to the body, effectively reducing the amount of penile tissue that can project outward. This does not just affect length, It also affects girth because less of the total tissue structure is able to expand freely. So, what is the solution? The 2-minute stretch I am going to teach you addresses all of these issues simultaneously. It releases pelvic floor tension, stretches the fascia, improves blood flow, and releases ligament restrictions. This is not some gimmick or quick fix that provides temporary results. This is about creating lasting change in the tissue mechanics and blood flow dynamics of your pelvic region. Before I explain the technique, let me talk about why this works so quickly. When you properly stretch and release chronically tight tissue, the effects can be immediate. The muscles relax, the fascia releases, blood flow improves, and the tissue suddenly has room to expand. You are not growing new tissue. You are simply allowing existing tissue to reach its full potential. This is why some men notice a difference the very first time they perform this stretch. They are finally experiencing what their natural girth actually is when nothing is restricting it. Now, let me walk you through the technique. This stretch has 3 components that work together. The first component is pelvic floor release. The second is fascial stretching, and the third is ligament lengthening. You are going to perform all 3 as part of one continuous movement pattern. Start by finding a comfortable private space where you can focus without distraction. You can do this lying down or standing, but most men find lying down more comfortable when they are first learning the technique. If you are lying down, lie on your back with your knees bent and feet flat. Take a few deep breaths and bring your awareness to your pelvic region. The first part of the stretch involves releasing the pelvic floor muscles. To do this, you are going to perform what is called a reverse Kegel. Most men have heard of Kegel exercises where you squeeze and tighten the pelvic floor muscles. A reverse Kegel is the opposite. You are actively relaxing and releasing these muscles. To find the right sensation, imagine you are trying to start urinating. That gentle bearing down sensation, that feeling of release in your pelvic floor, is what you are looking for. You are not straining or pushing hard. You are simply releasing tension and allowing the muscles to relax downward. As you perform this reverse Kegel, breathe deeply into your belly. Deep diaphragmatic breathing helps activate the relaxation response and enhances the release of the pelvic floor muscles. Hold this relaxed state for about 30 seconds. Breathe slowly and deeply, maintaining that sense of release in your pelvic floor. You might feel a subtle sensation of increased blood flow or warmth in the pelvic region. This is normal and indicates that you are doing it correctly. The second component involves fascial stretching. While maintaining the pelvic floor release, you are going to add a physical stretch to the penile tissue and surrounding fascia. Using one hand, gently grasp the shaft of the penis near the base. You are not squeezing tightly, just holding firmly enough to maintain contact. With steady, gentle pressure, pull the penis straight out away from your body. This is not a forceful yank or aggressive pull. It is a sustained, gentle stretch that you can hold comfortably. As you hold this stretch, you might feel a pulling sensation not just in the visible penis, but deeper in your pelvis. This is exactly what you want. You are stretching the internal structures, the ligaments, and the fascia. Hold this position for about 30 seconds. The key is steady, sustained tension, not quick or jerky movements. Think of it like stretching a muscle before exercise. You want gradual, sustained pressure that allows the tissue to release and lengthen. The third component involves directional stretching to address the ligaments and ensure even tissue expansion. After holding the straight out stretch for 30 seconds, you are going to perform gentle stretches in different directions. Still maintaining the pelvic floor release and deep breathing, pull the penis gently to the left and hold for 15 seconds. Then pull gently to the right and hold for 15 seconds. Then pull gently downward toward your feet and hold for 15 seconds. Finally, pull gently upward toward your head and hold for 15 seconds. These directional stretches ensure that you are addressing restrictions in all the surrounding tissue, not just in one plane. Different parts of the fascia and different portions of the ligaments are engaged with each directional change. By stretching in all directions, you create a comprehensive release of restrictions throughout the entire pelvic region. Throughout this entire 2-minute routine, the key is to maintain that relaxed state in your pelvic floor. Keep breathing deeply and slowly. If you notice yourself tensing up or holding your breath, pause and reset. The relaxation is just as important as the physical stretching. Tension works against what you are trying to achieve. The goal is to create space, release restrictions, and allow blood flow, not to force anything. Now, let me explain what is happening at the tissue level during this stretch. When you release the pelvic floor muscles, you are removing the compressive force on the internal penile structures and blood vessels. This immediately improves blood flow potential. When you physically stretch the penile tissue and ligaments, you are creating what is called a tensile load on the fascia. This tensile load signals the fascia to release and remodel. Fascia is adaptable tissue. When it receives consistent, appropriate stretching signals, it responds by becoming less restricted and more pliable. The ligaments also respond to sustained stretching. Over time and with consistent practice, ligaments can lengthen slightly, allowing more of the internal penile structure to project outward. This is not about damaging or overstretching the ligaments. It is about allowing them to achieve their natural optimal length rather than remaining in a chronically shortened state. Blood flow improvement is perhaps the most immediate benefit. When the pelvic floor relaxes and restrictions release, blood can flow more freely into the erectile tissue. This increased blood volume directly translates to increased girth. Remember, girth during arousal is largely determined by how much blood can fill the erectile chambers. Remove the restrictions, improve the blood flow, and you improve the girth. The beauty of this technique is that it addresses multiple restriction points simultaneously. You are not just working on muscles, or just working on fascia, or just working on ligaments. You are addressing the entire system of restrictions that may be limiting your natural girth potential. This comprehensive approach is why the results can be so noticeable, and why some men see immediate improvements. Consistency is important for long-term results. While you may notice an immediate difference after performing this stretch, lasting change requires regular practice. The tissue needs repeated signals to remodel and adapt. Performing this 2-minute routine once or twice daily creates a consistent stimulus for the fascia to release, the ligaments to lengthen, and the pelvic floor muscles to develop a new, more relaxed baseline state. Over time, the changes become more permanent. The fascia remodels to a less restricted state. The pelvic floor muscles develop new resting tension patterns, the ligaments achieve their optimal length, and the blood flow improvements become consistent rather than temporary. This is how you create lasting enhancement of natural girth rather than just temporary changes. It is important to understand that this technique is not about creating something that is not there. It is about revealing and releasing what is already there but has been restricted. Your body already has the tissue, the structures, and the blood flow capacity. They have just been limited by restrictions that developed over time. By systematically releasing these restrictions, you allow your natural anatomy to function at its full potential. Some men worry about safety with any kind of penile stretching. This technique is safe when performed correctly because it relies on gentle, sustained pressure rather than forceful manipulation. You are working with your body's natural capacity to release and adapt, not forcing tissue beyond its limits. The key indicators that you are doing it correctly are that it should feel like a comfortable stretch, never painful, and you should be able to maintain relaxed breathing throughout. If you experience any pain, sharp sensations, or discomfort, you are applying too much pressure or tension. Back off and use gentler force. The goal is therapeutic stretching, not aggressive manipulation. Think of it like stretching any other part of your body. You want to feel tension and stretch, but you should always remain in a comfortable range where you can breathe and relax. The pelvic floor release component is particularly important for overall pelvic health beyond just girth. Chronic pelvic floor tension is associated with various issues, including urinary problems, discomfort during sexual activity, and reduced erectile quality. By learning to consciously relax these muscles, you are improving overall pelvic function. Many men report improvements in multiple areas of pelvic health once they learn proper pelvic floor control. Breathing deserves special emphasis because it is so central to making this technique work. Your breath directly influences your nervous system and muscle tension patterns. Shallow chest breathing activates the stress response and increases muscle tension throughout the body, including the pelvic floor. Deep diaphragmatic breathing activates the relaxation response and facilitates muscle release. This is why maintaining slow, deep breathing throughout the stretch is not optional. It is essential to getting results. The reverse Kegel component might feel awkward at first if you have never done it before. Many men are more familiar with regular Kegels, which involve tightening and lifting the pelvic floor. The reverse Kegel is the opposite motion, a gentle bearing down and release. It might take a few practice sessions to really get the feel for it. Once you do, you will notice that you can consciously create a sense of relaxation and release in your pelvic region, which is exactly what is needed to remove restrictions. The directional stretching component ensures balanced release. If you only stretch straight out, you might address some restrictions but miss others. The fascia and ligaments have fibers oriented in multiple directions. By stretching in all four directions, you ensure comprehensive release. This balanced approach also helps prevent any asymmetry in tissue development. One common question is whether this technique can help with issues beyond girth. The answer is yes, because you are improving pelvic floor function, releasing fascial restrictions, and enhancing blood flow. This technique can also improve erectile quality, reduce discomfort during arousal, and enhance overall sensation. These benefits all stem from the same root cause, releasing restrictions and optimizing tissue function. Another question men often ask is whether results are permanent or whether you need to continue the stretching indefinitely. The answer is somewhere in between. The initial release of restrictions and improvement in blood flow can happen quickly and provide immediate results. However, maintaining these results requires some ongoing attention. The good news is that once you have achieved significant release and remodeling, maintenance becomes easier. You might only need to perform the stretch a few times per week, rather than daily to maintain your results. The 2-minute time frame is not arbitrary. Research on tissue, stretching, and fascial release has shown that sustained holds of 20 to 30 seconds are optimal for creating tissue change without causing damage. The routine I have outlined provides multiple 30-second holds with directional variation, totaling right around 2 minutes. This is enough time to create meaningful tissue response without being so long that it becomes burdensome or difficult to maintain consistency. Think of this technique as a form of physical therapy for your pelvic region. Just as physical therapy can release restrictions and improve function in your shoulder, back, or knee, this targeted approach can release restrictions and improve function in your pelvic structures. The principles are the same. Identify restrictions, apply appropriate therapeutic stretching, improve blood flow and tissue quality, and create lasting functional improvement. The fascial system is particularly responsive to this type of work. Fascia has something called mechanoreceptors embedded throughout it. These are specialized nerve endings that detect pressure and stretch. When you apply sustained stretching pressure, these mechanoreceptors send signals that can trigger fascial release. This is part of why the stretching can produce relatively quick results. You are working directly with the body's built-in mechanisms for tissue adaptation. For men who have been dealing with concerns about girth for a long time, this information can be life-changing. It shifts the narrative from something you cannot control to something you can actively address. Instead of feeling resigned or considering expensive and risky procedures, you have a natural, safe, effective technique you can use in the privacy of your own home. I want to emphasize that this is about health and function, not about chasing unrealistic standards. Every man's anatomy is different, and natural variation is completely normal. The goal here is not to achieve some arbitrary measurement, but rather to ensure that your tissue is functioning at its full natural potential without restrictions holding it back. If you have been concerned that you are smaller than you could be, this technique addresses that concern by releasing whatever restrictions might be present. The immediate feedback you get from this technique is one of its strengths. You will be able to tell relatively quickly whether you are experiencing benefits. Some men notice improved girth the same day they start performing the stretch. Others notice gradual improvements over a few weeks. Either way, you will have clear feedback about whether the technique is working for you, and you can adjust your approach accordingly. Thank you for taking the time to learn about this important topic. Understanding how pelvic floor tension and fascial restriction affect girth is the first step toward addressing it. The 2-minute stretch I have shared gives you a practical tool to release these restrictions and allow your tissue to reach its full natural potential. Consistency is key, so make this part of your regular routine and give your body time to respond and adapt.